Number 5, there are some high-income uninsureds. Most of them tend to be lower income, but 30% of the uninsured, about 13 million people, have incomes of more than $50,000 a year. Half of that population have incomes more than $75,000 a year. So if you're beginning to get a picture here of the uninsured, you find it's really a diverse group. A lot of them are young, healthy people and don't necessarily need insurance. They probably should have it, but they feel like I'm young, healthy. If I've got an extra dollar, I want to spend it on a new car or pickup or stereo or something like that, rather than spending it on health insurance. But because they're young and healthy, they don't tend to go to the doctor an awful lot. A lot of them are minorities. A lot of them are lower income people, but that's not true of all of them. Number 6, the uninsured and the uninsurable are not the same. There seems to be an impression that if you're uninsured, you can't get health care. You can get health care. One of the ways we know that somebody, when they're talking about it, doesn't know what they're talking about is when they say there's 46 million Americans without health care. Just because you're uninsured doesn't mean you can't get access to health care. It just means you don't have a third party paying for that access to health care. There's a fairly small percentage of the population that are uninsurable. And incidentally, in the group market, where the vast majority of Americans get health insurance, and in the government markets, Medicare and Medicaid, it is what we call guaranteed issue. You go to work for an employer, you get in the pool. They can't deny you coverage. They may be able to put a little bit of waiting time on you, but you get coverage. The real problem is in the individual market, where somebody has become uninsured and then gets a medical condition and then wants to try to buy health insurance after they get the medical condition. The same way as it would be a problem as if you had no auto insurance, had a car accident, and then said, I need to go call an auto insurance company to get some insurance to cover this accident I just had. It creates some real perverse incentives. But that number of uninsurables, a relatively small percent, 2–3% of the population, it's a pretty small percent. Most of the uninsured can go and buy a health insurance policy if they could afford it and if they want it. Number 7, the number of uninsured varies significantly from state to state. The southern states, Texas has 27% uninsured, New Mexico 25%, California 20%. Minnesota, by contrast, 10% uninsured. Iowa, 11%. Massachusetts, where they had passed health care reform 3 years ago, that's become something of a model for what President Obama and Senator Kennedy want to do in health care reform, they have reduced their uninsured population down to around 3%, according to official estimates. Now, for them, the goal was getting people covered. So they got a lot of people covered. They've achieved a lot of that goal. They're also spending a whole lot more money than they anticipated they'd be spending. It's breaking the bank there in Massachusetts, and they're trying to figure out how they can get control of the cost there. Number 8, state regulations are a primary factor for the number of uninsured. As I mentioned, we go around and track the state mandates from state to state, what the state insurance, what the legislature says insurance has to cover this, has to cover that, has to cover the other thing. Most states have 40, 50 mandates now. The great state of Washington has 57 mandates. You're up there towards the top. I think Minnesota comes in the top with 68. However, right next door to you in Idaho, they have 13 mandates. 57 mandates here, 13 mandates in Idaho. I am betting you have never read an article that said people are falling over dead in Idaho because they don't have as many mandates in Idaho as they do in Washington. Those mandates drive up the cost of health insurance. It makes it more comprehensive. It makes it nicer. It also makes it more expensive. It's like a Cadillac. It's like a Cadillac for health insurance. It's nice if you can afford one, but not everybody can. And in health insurance, you often don't have a Chevrolet model out there because of what the states are doing. In other words, the states play a huge role in increasing the cost of health insurance, and then they go out and often blame everybody else for the cost of it. Number 9, being uninsured does not mean there's no access to health insurance. As I mentioned, that is a huge problem. It's a problem, but it's just because you're uninsured doesn't mean you don't have access to health care. You can get access to health care, even with the statutes called EMTALA. You show up in an emergency room, you're going to be able to get care. Being uninsured is not the same thing as having no access to health care. And finally, the uninsured have access to alternative plans, less expensive options out there if the states will allow them. There's a lot of alternative policies out there that are not comprehensive, that are much less expensive, but states often try to restrict those plans or don't want people to have options, to have those options. They can be what we call limited benefit plans. They can have, we call them mini-meds. They can be high deductibles with health savings accounts involved. There are a lot of less expensive alternatives. Sometimes the insurers, sometimes it's Blue Crosses, and the various states, because it varies from state to state, tend to try to keep people from having access to those various types of plans. And states will sometimes say, we're going to impose these various mandates on it, making those plans more expensive. If the states back off of those regulations and allow a competitive market out there, you will find that there will be a lot of options out there for people to be able to get affordable health insurance. I don't want to minimize the problems of the uninsured. There are problems out there with our system, especially with the uninsured, and especially if you're uninsured and you end up with a medical condition. All of us face these things. Sometimes we're having to go get health insurance. We're having to go through our insurance company to get something paid for, and we sometimes run into bumps in that. There are some problems in the system. But if the goal is to try to get the uninsured covered, we need to understand that the uninsured is not one monolithic population. It is a varied population, and targeting our solutions, especially to covering lower income people to make sure they have access and money to be able to get health insurance, targeting those solutions is a lot less expensive than what they're considering in Washington, and it's a lot more doable. You don't have to do sweeping healthcare reform to solve the problem of the uninsured. You simply have to do some targeted solutions that will cover the vast majority of the problem and be able to save a whole lot of money in the process. With that, I'll stop. Thank you.